I would like to welcome you to my channel, That Middle-Aged Lady. For those of you who are familiar with me and my channel, you know that I have been on a journey throughout this past year after being diagnosed with a postmenopausal cyst on my left ovary and am currently scheduled to have surgery tomorrow, being October 10th, to have both of my fallopian tubes and ovaries removed. If you are new to my channel and want to hear more about my story, I do already have several videos uploaded that go into a lot more detail, so I hope that you'll check them out. But as I said, I am currently scheduled to have surgery tomorrow. I am staying the night at my daughter's house since she will be the one taking me, and we have to be at the surgical center at 6 o'clock in the morning. And then I will be my doctor's first patient of the day, and that surgery is supposed to take place at 7:30. So I'm hoping by being the first patient, that means I'll also be the first to get out of there, assuming everything goes okay. And so the reason that my doctor and I decided to go ahead and do this surgery is because although this cyst has remained relatively small, currently it is right about 1 centimeter, or at least it was at my last ultrasound that was done about 5 weeks ago. And he also doesn't seem to think it meets, any type of criteria for cancer, considering it doesn't have any solid components, there's no blood supply going to it, I have no free fluid, and then I had a CA-125 blood test done about 8-9 months ago that came back normal. I have, however, been in quite a bit of pain from this cyst, starting from the very beginning of when I was diagnosed with it. That, coupled with the fact that I have been postmenopausal for about 8 years now, and being postmenopausal as we begin to age means our chance of ovarian cancer then rises. So because I don't need the ovaries anymore, and because I am in so much pain, he just felt that, and I agreed, that it would just be best to take the ovaries, just in case there is something more serious going on, that hopefully we will have caught it early, or if perhaps something more serious was going to occur down the road, the ovaries would be gone and I would no longer have to worry about that. And so it has been quite a journey thus far. As I've said in previous videos, I have had right around 9 ultrasounds done already, just kind of monitoring the cyst to see if it was actually going to do anything, or maybe if I got lucky, go away altogether. And then, it started off with me going to the emergency room because of the pain, where I had a CT scan that came back normal. From there, I went to go see my gastroenterologist, where I had a colonoscopy, the upper GI, which is a scope down the throat, and then also a HIDA scan that tests the function of the gallbladder. And when all those came back okay, was sent to see the gynecologist, where I had a uterine biopsy done that came back normal. That is when they discovered that I had this cyst on my left ovary, which at that time measured 9 millimeter by 9 millimeter, so just under 1 centimeter, and which is also when I had that CA-125 blood test done. And so it's taken a long time to get to this point of, coming to terms with the fact that, did I want to go ahead and have the surgery done? Was it really necessary? And then getting to a point where I worried, there were times where the symptoms did seem to be getting a little bit worse. And I did worry that maybe perhaps it might be something a little bit more serious than just a simple cyst. So emotionally and mentally, I feel like it's been just as hard on me as it has been physically with the pain from that ovary. So I am going to be glad to have this done. And even if, God forbid, he gets in there and he realizes that, this maybe perhaps is cancerous, or sends away the biopsy and realizes that it was a little bit more serious than what he thought, my hope is that by doing this surgery now, we will catch it in time before it spreads and gets any worse. And so, mentally, that's my thought process at this time, is that no matter what, it has to be done, because we have to know definitively for sure what's going on. And this is really the only way to know it. And so I just wanted to make sure and document this for any other woman out there who might also be going through the same journey right now, just to let you know what all the steps are. And even though all of our experiences are going to be different, our circumstances are different, our doctors are different, our bodies are different, I still wanted to be able to just let everybody know every step of the way, everything that I've had to go through, as I just feel like it really helps to, know somebody else has gone through some of the same things that you have. And so I will be back tomorrow morning once I get to the surgical center, and just kind of hopefully document a little bit of those steps along the way. I'm hoping my daughter will help me with that process. And then after surgery, once I'm able to actually talk and do a video, I will absolutely let everybody know what the findings were, and of course what the healing process is like. And so obviously still have a little ways to go with this being the eve of the surgery, hoping I can at least get a good night's sleep tonight before I have to wake up too early and finally be on my way. And so other than that, I will be back tomorrow morning to share the rest of this journey with you. It is the day after surgery, and I am home now. I apologize if I don't look the best. I'm sure there would be some women who would be up brushing their hair, curling it, and putting on makeup, but that is the last thing I feel like doing right now. I actually feel pretty good that I was able to get up and actually brush my teeth. So at least I accomplished that much. But I wanted to do a video once I made it to the surgical center yesterday, but unfortunately my daughter and I had a little bit of a hard time finding it since it was kind of tucked back in this industrial area. So by the time we actually got in, it was about 10-15 minutes later than what I was supposed to be there. So they had me sign a bunch of paperwork, and then they whisked me back to where I had to change into their little gown and then get the IV started. And then, of course, everybody asked all those wonderful questions, such as what medications I was on, if I had had anything for breakfast that day, any health concerns, and that type of thing. And then from there, the doctor came in and talked to me a little bit, told me exactly what he was going to be doing. And then the anesthesiologist came in and again, just wanted to go over what medications I was on, make sure I didn't have anything to eat all, since midnight the night before. And so after all of that, it was already time to whisk me away for surgery. So I was kind of surprised over how quickly it actually happened. And then my daughter wasn't even able to come back until after they were just getting ready to take me. If you hear kind of almost like a buzzing noise, it's because this time, it's funny, I had surgery done about 3 years ago for an umbilical hernia, and I had that done at a hospital, but this time this was done at a surgical center, which interestingly enough, I learned my doctor actually is part owner of. So no wonder he wanted me to go to that surgical center, but I have to say that they were absolutely wonderful. Everybody who worked there was very attentive. They were very respectful. And if I had to have surgery, I would definitely go back there again. But they sent me home this time, and I'll go ahead and show you. I have to flip it around to show you exactly what these are. But they're called plasma flow, and you put them on your calves, and what it does is when you're laying down, it just helps to keep the blood flowing in your legs so that you don't get a blood clot. And so I'll go ahead and show you what those look like. This is what the box looks like. And then this is what the units themselves look like. So basically it's like a blood pressure cup that you would put on your arm, and then it kind of inflates and squeezes your arm. It squeezes the calves, and it goes up to a certain pressure, and then eventually it will decompress again. And apparently the point of it is when you're laying down, your blood's not circulating, so it helps to get that blood circulating in your legs, which I think is a good thing. And I'm supposed to wear these for about 2 or 3 more days. So anytime I'm laying down or sitting down, I wear them, but if I'm up and walking around, then I can take them off. And again, I've never seen, I know that they put them on during surgery, and now that noise is done because they're going to decompress and all that pressure is going to go back out. Now the other one's doing it. Right now it's filling up. So I've never, had been able to take anything like this home with me before. So that was something was definitely new. The other thing that was different about the surgical center is they didn't have me use a spirometer, which is this little apparatus that you would blow into. It has a little ball. And the point of it is you would blow in and then you would have to hold your breath, or maybe it's suck out. I can't remember. It's either blow in or suck out. And then you would have to keep the ball at a certain place in that little device. And it helps to kind of inflate your lungs because after being having surgery and being laying down for so long and having a breathing tube in, you have a chance of getting pneumonia. So they just like your lungs to be nice and open, and they didn't do that. And so I do have a lot of phlegm. I had a lot of phlegm going into it. I had a lot of phlegm coming out of it. So I'm having a little bit of a hard time getting that up. I did have my daughter go and pick me up some Mucinex before she left yesterday, and that has helped a little bit. But I find when I'm laying down for too long, it definitely starts to seem to get caked up in there in my chest. So I'm trying my best to cough it up without actually coughing too hard and breaking one of those incisions open. So how did the procedure go, which is what I'm sure everybody is probably wondering the most about. As they were wheeling me back, the anesthesiologist said she was going to give me a nice little cocktail in my IV. And she did, because I started to feel very kind of groggy. So they put first they put an oxygen mask on me, and then I was out. I have no idea what they did after that. I woke up in a room, the recovery room. I was freezing for some reason. I couldn't stop shaking. So they had to get me a special warming blanket, and then the nurse put something in my IV to help with the shakes. I have no idea why I was shaking like that. And then a short time later, my daughter was able to come in, and that was when I was told that everything went well. Thankfully, he did not see any cancer. I do have pictures that I'm going to go ahead and show everybody here in a minute. So I'll give you a warning of that just in case you're, the type of person that you're a little squeamish and you don't like to see that kind of stuff. It's not really any blood or anything like that. It just kind of shows what the cysts look like and what the ovaries look like. And I personally found it very interesting to at least see what exactly he got to see in there. So everything went well as far as that goes. He did take both ovaries, he did take both fallopian tubes, and he thinks the problem of why I was experiencing so much pain, because just like he had been saying all along, the cyst was very small and there should have been no reason that it was causing any pain, was when I had my hernia surgery. Apparently there is a section over by my ovary that did not heal right. I don't fully understand this yet, as it was the nurse and my daughter who were telling me this. By then the doctor has already gone on to his next patient. So when I go back in to see him in 3 weeks, I will definitely be asking about that. But apparently there was something from left over from the other surgery that he had to end up pulling up. I guess when he did, it started bleeding and he wasn't too happy about that. He told my daughter, this really wasn't my area of expertise, but there was no way I was going to send your mom home with that same pain and then have her have to go see a doctor and get cut back open again. He said, I rather would have just taken care of it while I was in there. So there is a picture of that as well, whatever it was. Again, I'm not 100% sure yet, but he was able to take that up. And so hopefully, once I heal, I'll be able to tell. I can say that when I got home yesterday, I was surprised at how quick it was. They said it would take about an hour. It was right about an hour for the surgery. My daughter dropped me off at home while she went to the pharmacy to pick up my pain medication. They have me on Norco, which I'm only going to take at night just because I'm not real big on taking medication. Even taking it at night, it's now 10 o'clock in the morning and I'm still tired from it. So I just don't want to be, groggy all day. But once I got home, I was surprised at the level of pain not being so bad. When I had my hernia surgery, it was horrible. I'm starting to think now that maybe that doctor wasn't as good as I thought he was, the gastroenterologist that performed my surgery. And I definitely wasn't happy with the staff afterward, as my incisions, they would use this little, like this glue stuff to keep them intact. And when I got home, I noticed that, it was a umbilical hernia, which was down by my belly button. And yet the glue was all the way up to my breasts and my neck. And I'm thinking, how in the heck did you get glue up here if the incision was down by my belly button? So I just felt like they were sloppy and really didn't care. And needless to say, I complained about it, but after going through this surgery now, it was the same laparoscopic surgery and my incisions were so much better. So really starting to wonder if maybe that doctor wasn't as good as I thought he was. But anyways, got home yesterday, didn't feel really all that bad because of all the pain medication I was on and from anesthesia. And so I slept most of the day. Got up last night, tried to walk around a little bit, use the bathroom, brush my teeth. I did have something little to eat. I didn't want to eat too much, but I had to have something if I was going to take those pain meds. And went back to sleep, slept well throughout the night. When I woke up this morning, definitely a lot more sore. And then in a second, I'll go ahead and show you my incision site as well. It looks like this time he went in through my belly button, which I'm really surprised. But I think he was scared because of the fact that I did have previous surgery. Sometimes it can leave scar tissue. Fat is easy for them to cut through, but scar tissue can be more difficult. And then what happens is when they they have to kind of put a little bit more force into it, they could accidentally either nick your bowel or your bladder. And he didn't want that to happen. So I think he decided to take a different pathway just so that, that didn't end up happening. And I'm glad he did, because obviously I don't want that to happen either. So it looks like one incision is down near by where my ovary would have been. One looks like it's maybe somewhere in my belly button, and I don't see the other incision. There's supposedly supposed to be 3, but I personally don't see the other one, so I have no idea where that one is. Here is the incision on my belly button. I'm sorry if I'm too close. I don't have anybody here that can hold my phone back further for me. And so I can't show you the one that's down a little bit because it's more in my pelvic area, so I can't really show you that one. But this was my belly button. It wasn't bruised yesterday. It is now, and I'm sure the bruising will go away in a few days. I am keeping ice on everything. He did say to make sure and ice everything. And then the other thing I noticed, I'm assuming because they hold your face back and, with the breathing tube underneath my chin right here, it's so incredibly sore. So I'm assuming that probably had to be with the way, however my head was positioned during surgery. So here is the part about the pictures. So if you want to look away, totally understand, or fast forward to the next section. But for those of you who might be interested in seeing what this looks like. So the first picture is of my uterus, which looks healthy and is why he didn't feel the need to remove it. The next picture is of one of my fibroid tumors. I have 2 of them. This one is the one that measures right around 3 centimeters. This would be the second fibroid tumor that measures around 2 centimeters. This would be my left ovary. And as I said, the cyst was an adnexal cyst, which means it's on the outside of my ovary. And if I'm not mistaken, that is the fallopian tube. They can also either form in the fallopian tube or just outside of the ovary, which is what mine did. It looks pretty much perfectly round. The next one would be of my right ovary, which I always, I always heard that they look like an almond, or they were shaped like an almond, but that just doesn't look like an almond to me. It's just very weird. And to think all of our eggs were stored in that tiny little organ right there. Just, it's fascinating to me. And that one, the right one, definitely looks different than the left one to me. And then this bottom picture right here would be after he removed the left ovary and the cyst. So now that's all gone in the fallopian tube. And then this picture down here would be of what I was referring to when I said that he said that there was some type of adhesion that he felt was causing the pain. So I will get more information when I go back in, but it's definitely, I don't know exactly what that is. Definitely strange to see. I'm just glad that he removed it, because otherwise the surgery could have been for nothing. If the cyst wasn't cancerous and it was small enough that it wasn't causing me any pain, and this was, if he didn't remove it, then I would have still been in pain. So, and then the next picture is a little bit more gory, so if you want to look away, feel free, because he did say it bled quite a bit after he took that out, and that's what it looks like afterward. Looks pretty raw, so I'd imagine that's probably going to take a little bit of time to heal. But that would be my pictures. I think that's going to be it for today's video. I'm starting to get pretty tired. This phlegm is driving me absolutely crazy, so I think I'm going to get up and walk around for a little bit, get some water, see if maybe that doesn't help to kind of break it up a little bit, get some fresh ice for my wound, and then I think it's time to take a little nap. But I will definitely be back in a few weeks after I've had a chance to heal some more and talk to my doctor, just in case there's more information to share. But in the meantime, I want to thank everybody so much for joining me and for supporting me throughout this whole process. I have definitely learned a lot along the way, and I am so happy that I've been able to share it with everybody. And again, after I feel a little bit better in a few weeks, I definitely will have more that I want to share and say. But right now, I just feel like it's time to, relax and go ahead and take a nap. But again, thank you so much. And if you have any questions or comments, please feel free to leave them. Other than that, I will see you soon.